So at the ELCC meeting, we also presented our data on the use of ctDNA NGS here. Just over 180 sequential patients were tested with routine standard tissue testing and ctDNA testing using the Guardant G 360 test, and really it demonstrates what we have known about ctDNA utility from other data sets, which is that it is actually quite useful and complementary to tissue testing. We identified 43% more tier 1 variants by ctDNA than in tissue, but similarly we identified tissue identified 26 tier 1 variants as well. The ctDNA was much quicker, with a median time to result of around 9 days compared to about 24 days for tissue testing. And that's quite important because it allows us to have some confidence to start our patients on treatment earlier, especially if it's an informative sample. However, around 10% of patients don't shed ctDNA, and it's really important to recognize there are limitations in using ctDNA, but to my mind, it's very complementary to tissue testing, and both really do have big advantages to deciding the optimal treatments for our patients and making sure they get on the right treatments at the right time.